Hello, welcome and namaste everybody. We welcome you all in our weekly reunion and weekly family reunion rather of this eSIP module 2 holistic human health. We have our resource person very near and dear Dr. Akhilesh Shukla with us. Dear Akhilesh Bhaiya, namaste.
भैया नमस्ते।
Hey, namaste Bhaiya. So we still have a couple of minutes, but still
जी भैया।
many have joined. So if anybody like to reflect upon the previous session or ask any question, are most welcome. Is that okay, Akhilesh Bhaiya?
जी भैया, very much.
जी.
So
And what topic we are going to discuss Bhaiya, in this session today?
today भैया we will discuss about the allergic rhinitis and its initial management.
Nice. Till then, if anybody, so we will start in a couple of minutes. Till then, if anybody would like to interact, are most welcome. So welcome, Akhilesh Bhaiya. Over to you. Namaste.
Thank you so much भैया. So any of the participant, if they would like to share something or if they have any query, they are welcome to share and ask. So may I know if the slide is visible and my voice is clear to you all?
Yes, slide is visible and your voice is also very loud.
Okay.
Ji.
So welcome once again in this weekly holistic health session. So in today's topic, we will discuss about the allergic rhinitis prevention and initial management. So as this is the transitional period of changing the season from summer season, we are entering into the rainy season. And actually this transitional period, the ongoing season, the last week and coming 1 week of the next season, that period is very vulnerable for this kind of condition, allergic rhinitis. So many people, they suffer with some kind of throat irritation, running nose. So I thought to discuss this topic in this today's session. So allergic rhinitis, when we say, so what is allergy? So well, allergy, sometimes medically we referred it as hypersensitivity. But in general language, sensitivity, we also take into the some emotional sense, and we say that person is very sensitive. But here, when we say hypersensitivity, it means that he is allergic to something. And when we say allergy to something, that means allergy, it is exaggerated reaction of our immune system to foreign substances. Generally, we say it as allergens. That does not bother or harmless in most of the people. So for most of the people, they will be very comfortable with this allergens or foreign bodies. But some of the people, they will be having very hyper reaction, hypersensitivity towards that particular foreign body or allergens. And that is because of our immune response for that particular foreign body. So what are these allergens or foreign bodies which we are seeing? So this may be this pollens, house dust. You may have seen that whenever you are cleaning your house or cleaning your car, etc., dusting. So that this the particles of the dust that will cause hypersensitivity, or immediately the person will feel lot of running nose, sneezing, coughing, that all. And pets and farm animals. So for many of the people, it will be very comfortable to have the dogs, cats, or any other cows, etc. But for some of the people, that itself becomes the causative factor for hypersensitivity. And for few people, the food also. So like some of the people, they are allergic to some kind of food items, some vegetables. It may possible that they are allergic to some of the green and leafy vegetable also, which are very healthy. But one may have allergy and one may suffer if he is consuming. Like I have seen some of the people, they are allergic to the bacon, or some of the people, they are allergic to some kind of vegetables, leafy vegetables, including spinach also. Some of the people, when they take spinach, suddenly they will start sneezing, coughing, etc. Medication. So including some of the very generally we consider as very safe medicine, including the paracetamol, cetirizine, that also creates allergy to some of the people. And content allergens like the metals, fragrance ingredients. So like some, if they are in contact with some kind of metals, so the person will have some skin allergy, rhinitis, these kind of symptoms, or some kind of fragrance. They may be some kind of this incense stick, or it may be the spray. For many people, it will be very normal, but a particular person may suffer and he may have the headache or redness of the eyes, watering from the eyes, or watering from the nose, that all kind of symptoms. And the venom in insects, stings and bites. So like mosquitoes or the wasp or the this honeybee, if they bite, one person may not have severe problem, but some of the people, including the mosquito bite, may cause lot of trouble. So these all are the common allergens, but the list does not include only this, but there may be so many other items which may be included here in this list. So what is rhinitis? So whenever you will find the word itis, that indicates the inflammation. So inflammation of the mucous membrane of the nose. So the mucous membrane, it is lining our the nasal cavity. So inflammation of that is called as rhinitis. So common symptoms are rhinorrhea, that means the watery discharge from the nose, nasal congestion, the person will have difficulty in breathing, itching and sneezing. So person will have a lot of irritation, itching sensation in the nasal cavity, and repeated sneezing. So these all are the common symptoms which we see whenever the person is having allergic rhinitis. So rhinitis is generally caused by the allergic reaction. So allergens we already discussed, and this allergic reaction is an atopic, and this allergic rhinitis is an atopic disease characterized by symptoms of nasal congestion, clear rhinorrhea, sneezing, post-nasal drip, and nasal pruritus. So he will be having pruritus here, means a lot of itching sensation inside, and sometimes there will be slight bleeding also whenever he is scratching because of this irritation. There may be slight bleeding also because of the rupture of the mucous membrane and rupture of the small blood vessels which are present there. This allergic rhinitis, it affects 1 in 6 individuals, and it is associated with significant morbidity, loss of productivity, and healthcare costs. See, this condition is not fatal, it is not life-threatening. But what happens is, whenever a person is suffering with this sneezing, rhinorrhea, this watery discharge from the nose, repeated sneezing, nasal congestion, which causes breathing difficulty, redness of the eyes, watering from the eyes. So it is not life-threatening, but it is causing a lot of trouble, and the productivity of the person, his daily routine is severely affected. And again, in the market, the over-the-counter medicine. So that is also uh, one of the major part of this expenses goes to this related with this allergic condition. So many of the people, they will take cetirizine, they will take levocetirizine or the paracetamol, these kind of medication without consulting any doctor, going and buying from the shop directly. So the expenses are also involved along with this condition. And if a person is suffering only for few days, it is fine. But what happens if the person is suffering continuously for years together? And I have seen some of the patients that they are suffering from several years, but still they do not take it very seriously. They do not go to the doctor and they just buy some medicine, they get some temporary relief and continue their work. So that is the kind of things going on in case of allergic rhinitis, because it is not very life threatening. So the people also becomes careless about it and they just manage somehow with some this over the counter medicines. So this is one of the common disorder. And again, this is linked with asthma and conjunctivitis. So some of the times when allergic rhinitis, it continues for a long period, it may cause asthma, or the symptoms of asthma may aggravate because of the exposure to some of these allergens or because of this rhinitis. So that means this chronic asthma may take the shape of the acute and severe condition, and there may be chances the person needs hospitalization or some emergency medicines when he is exposed to these kind of allergens. And again, the conjunctivitis, that is also one of the problem which is faced by the person who is suffering with allergic rhinitis. Sometimes the combined effect is also seen. The combined symptoms, the person will be having the rhinitis and conjunctivitis both because of the exposure to some of these allergens. So what is the prevalence of allergic rhinitis? So this is one of the most common type of chronic rhinitis and affecting 10 to 20% of the population. So you can understand the kind of prevalence it is having and the kind of suffering it is creating to the population. So 10 to 20% is very big. And evidences suggest that prevalence of allergic rhinitis goes on increasing. So the people more and more, not only 10 to 20%, but even more number of people are suffering, and that incidence goes on increasing in the population. And it may also be because of their decreased immunity, because of the unhealthy lifestyle, because of the improper daily regimen, unwholesome dietary habits. So that is decreasing the immunity. When the immunity is decreasing, that is causing hyper reaction because of exposure to some of the common allergens. So it is becoming a bigger problem day by day. So we will see the classification of this allergic rhinitis. So based on the time of occurrence, it is divided into the seasonal or perennial. So when we say seasonals, that means occurring during a specific season. So some of the people, they may not suffer in all the season, but they will suffer in one particular season. Like some of the people, they suffer only from when there is a transitional period from the summer to rainy season. Or some of the people, they suffer when they are shifting from the summer to the spring season. So like this, in one particular time in a year, one particular season, specific season, the person will suffer. The second variety is perennial, which occurs throughout the year. So that means the person is suffering continuously throughout the year with this allergic problem. Whenever there is a changing of the season, in every season, he will suffer for 15 days, 20 days, continuously he will have this kind of problem. So this we say as the perennial kind of allergic rhinitis. Second is based on the duration of the symptoms. So it is intermittent and persistent. Intermittent, we say, when the allergic rhinitis symptoms that are present for less than 4 days per week or for less than 4 consecutive weeks. That means in a week, only 3 days, 4 days he is suffering, and these symptoms will not cross more than a month. So that kind of presentation we include under the intermittent kind of allergic rhinitis. The second is the persistent. So here the symptoms are present. Symptoms means the same: running nose, rhinorrhea, congestion, watering from the eyes, irritation, pruritus. These all kind of symptomatology is present, and that crosses more than 4 days a week, and for more than 4 consecutive weeks. The person will suffer for more than a month, and every week he will be having these symptoms almost throughout the week, more than 4 days. That means throughout the week he is suffering, and he is suffering more than a month. So such kind of presentation we include under the persistent allergic rhinitis. So based on the symptoms. So based on the symptoms, we divide into the 2 categories. One is mild and second is moderate or severe. So here what happens is, mild, when we say, you may have generally understood that the symptoms are not much troublesome for the person, or there may not be all symptoms present in that person. That means he may having only sneezing, but may not be much of this running nose, or he may be having some slightly watering but not much sneezing, or not much pruritus. So only some symptoms are present, and with these symptomatology, the person is able to carry out his normal routine work and all other office work, etc. He may not have to take the leave from the office. He will continue his normal routine work. The routine work is not much affected. So with such kind of presentation, we include it under the mild variety. But when symptoms are very severe and it affects the person's daily routine, including the sleep, he is unable to sleep because of the nasal congestion, because of the breathing difficulty, because of the running nose, continuous sneezing, coughing, redness of the eyes, watering from the eyes, pruritus. These all symptoms, they are troubling so much that he has to take leave. He will not be able to continue his normal routine work, and including the sleep will also be disturbed. So you know that sleep is one of the very important pillar of our healthy life. So if sleep is disturbed, that means his next day he will be very drowsy, he will not be active, his digestion will not be proper, he will not be having a very good mental state. So that all kind of symptoms we see because of this allergic rhinitis. So based on, again, if the symptoms are really very much dominant, we include it in the severe variety. If they are on moderate type of presentation, then we say it is the moderate allergic rhinitis. So like this, based on the season, based on the duration, based on the time of occurrence, based on the symptoms, and based on the severity, we categorize the allergic rhinitis in different groups. So what are the risk factors for allergic rhinitis? So the pollens, like the trees, grass. So suppose if some trees are present in near by his house, the person will suffer more. Or like the house dust, mites, or animal allergens. So if there are animals, it may not be in your house, but if the neighbor's house, there he is keeping some animals, or he is animal lover, so that may also create trouble to the next person. So that is also possible, and have a large geographical variability within and between the countries. So he has to shift from one place to another place, and because of this geographical and environmental change, the person may suffer with. He will be very much healthy. He will be having a normal kind of routine in his own native, but when he is shifting to some other place, he will be suffering. So that kind of things may also occur. Or exposure to the farm animals, exposure to the cats, dogs, etc., and maternal or paternal smoking. So if your workplace or in your home, someone is having this habit of smoking, so it may also become one of the problem, or the air pollution. Suppose if you are working in some kind of factory, etc., or your house is nearby some kind of industries where there is a lot of air pollution. So, or just near to the road, main road, where a lot of vehicles movement are there. Because of this air pollution also, it may cause allergic rhinitis, or it may trigger allergic rhinitis. How to diagnose this condition? How to know that person is suffering with allergic rhinitis? So, clinically, diagnosis made based on thorough history and physical examination. One important thing is we have to take a detailed history to understand whether the person is suffering with allergic rhinitis or not. And then the next part is physical examination. So thorough history, like uh, if a school going children, so we have, if a school going child, so we have to take detailed history. It may not be something related with the home, but if he is suffering, something may related with the school. So in a school, some kind of suppose in the, because of the exposure to the dust, or if it is a completely AC room, or if there are mattress, etc., which are spreaded in the school, or because of the location of the school. So everything. And again, if person is taking some kind of food items in the school, so everything we have to take in a detail, and that detailed history will able to help, will help to identify what are the factors which are causing trouble to this person. And again, in a different season, we have to take the history, we have to ask the questions, what are his situation and when exactly he is suffering with this kind of problem, or throughout the year he is suffering. So that all we have to take a detailed history about the food habits, about the lifestyle, about the home environment, about the working place environment. So everything we have to know to understand if the person is suffering with allergic rhinitis or not. The next part is the physical examination. So in the physical examination, we have to do the general examination, like we have to see whether the person is having nasal congestion and he is taking mouth breathing, or repeatedly the person is rubbing his nose because of the lot of irritation, or frequent sniffing, or throat clearance. So that all we have to observe carefully if the person is having these all kind of symptoms. Then if we examine the nose, there will be reddish discoloration or a redness of this nasal mucosa, or there may be, as I told, because of the lot, because of the repeated rubbing, or because of irritation when the person is putting finger inside, or um, casting some kind of rubbing in the nose. So that may cause rupture of the blood vessel, which are just beneath the nasal mucosa, that may create bleeding also. And pale thin secretion. So the secretion will be there, pale thin. So that also gives the idea that the person is suffering with this allergic rhinitis. And sometimes because of the continuous exposure to allergens, it may cause development of the polyp inside the nasal cavity. So when the polyps are developed in the nasal cavity, so it may further cause more trouble to the person. So he will be having continuously breathing difficulty, continuously irritation, and such patients will be having a clear mouth breathing pattern. Because of this development of this polyp, the airflow will be obstructed and the person will uh, take mouth breathing in such of the cases. So these all things may possible. And in the mouth, there may be enlarged tonsils or pharyngeal post-nasal discharge. So that means this our nasal cavity is connected with the oral cavity. So when there is a watery discharge which is seen outside, so it also goes to the mouth. So it may be having the post-nasal discharge also. That means the posterior aspects of the nose. So there may be watery discharge from inside also. That is coming to the mouth oral cavity. Then the allergic shiner, when we clearly observe the eyes of the person who is suffering with the allergy, then there will be dark area around under the eye. So he will be having a dark circle under the eyes. So that is also indicating that the person is suffering with this allergic rhinitis, and conjunctivitis suggest allergic rhinitis. So having this redness of the eyes, watering from the eyes, irritation, itching sensation in the eyes, so that all is seen, which is associated with the allergic rhinitis. So sinuses, palpation of the sinus for sign of tenderness. If you palpate just side of the nose or just near the eyes, inner aspect of the eyes, the person will be having pain that we say as a sinusitis. And many a times the allergic rhinitis is also associated with this allergic skin condition. So that what we say as the atopic dermatitis or eczema. So like some of the person, when they take some food items for which they are allergens to, what happens is it will create some sneezing, running nose, etc. Along with that, there will be some skin eruptions also. The person may be having some reddish elevated patches all over the body. So such symptoms are also seen along with this allergic rhinitis. And I already told about the asthma. So the person who is allergic, in long run, he may suffer with asthma, or if the person is having asthma, that may be triggered by the allergic rhinitis, and the breathing difficulty, etc., may be very severe in such person. So now, how to prevent this condition? So education of the patient, in general, children to their caregiver. So the first important thing here is we have to educate the person, we have to inform them that what are the factors causing trouble to you. And then we have to educate that he has to try to avoid that factor. Avoiding that triggering factor is one of the very important part of prevention from allergic rhinitis. Suppose he is allergic to some kind of food, some kind of medicine, or the farm animal, or the house dust, etc. So we can suggest some preventive measures that whenever you are cleaning your house, you have to cover your nose and mouth with mask, or maximum you have to avoid, or you can do some kind of other methods, like a little bit you can sprinkle water and then you can clean, so that will not cause this dust, much of this dust entering to your nose or coming to your respiratory system. So that all we can suggest. And use of mouth nose mask to avoid allergens. Then neti kriya. Neti kriya is a jala neti and sutra neti. That is the part of shat karma of the yoga. So the yoga practices jala neti, sutra neti, or sometimes we can go for the dugdha neti also. So that helps a lot for strengthening your nasal cavity and protecting you from this allergic rhinitis. Then the Nasya Karma, installation of oil into nasal cavity. So that is one of the procedure mentioned in our ancient Ayurveda system. So here you put few drops of oil. So what happens is this oil when you are putting into the nozzle cavity, it creates a barrier. So it comes over this nasal mucosa and creates a layer. So whatever the allergens which are causing problem or creating difficulty for the person, when there is a barrier, there is a layer of this oil which you have instilled. So it will not cause directly to penetrate your nasal mucosa and create trouble for the person. So this, if you practice continuously, it will help a lot to avoid or to prevent from this allergic rhinitis. And the important thing is care during the Ritu Sandhi. So seasonal transition period. So that we say as Ritu Sandhi. Sandhi means junction of these two seasons. So whenever there is a changing season, that becomes a very favorable time, or very, the person who are sensitive, they will suffer particularly this period, the last week of the ongoing season and the coming first week of next season. So that is the period when the person will suffer. So we have to ask them to maintain his healthy routine, and gradually he has to adopt the lifestyle of the coming season, and gradually he has to decrease or he has to drop the lifestyle of ongoing season. So that little bit care will help to avoid or to prevent from the allergic rhinitis. Then avoiding overeating, over drinking. Then massage of the lower extremities, especially the pada abhyanga, massage to the foot, that also helps to reduce the symptoms and to prevent from the allergic rhinitis. Then avoiding sleeping in the prone position. So we have to sleep in the supine position or the left lateral position. That is the most appropriate position for sleeping. Avoiding sleeping in prone position, that also helps to prevent from the allergic rhinitis or breathing difficulty, especially the person already suffering with some kind of respiratory problems. And maintaining healthy sleep time. So we have to take routine sleep, because whenever we are deprived of the sleep, so we are more prone to suffer with these kind of all problems, because deprivation of the sleep, again, it is affecting our immune system, it is affecting our digestive capacity, and the person become more prone for suffering from these all kinds of allergens. So proper sleep is one of the important part. So he has to take routine proper sleep in the night, and avoiding exposure to the head to cold air and taking a shower early in the morning. Whenever the person, he knows that he is having this kind of problem, so it is better that he should avoid taking bath early in the morning and taking bath from the head, especially with the cold water, so that he has to avoid. So that all will help to prevent from the allergic rhinitis condition. So what are the basic things we can do if the person is suffering with allergic rhinitis? So one of the very simple and commonly available medicine is Triphala decoction. Triphala is very common medicine, very easily available medicine, but it has a lot of benefits in many conditions. So in allergic rhinitis also, if we are taking Triphala decoction, it is very helpful in initial phase. So we have to just take 3 grams of Triphala powder, take 4 cup of water, mix it, then boil very slowly. Boil it and reduce to the nearly half cup, up to that, and just filter it and take when it is still slightly warm. So that will help a lot to reduce the symptoms of allergic rhinitis. The next common thing which we generally use whenever the person is suffering with rhinitis, cold, cough, all this is taking tulsi leaf juice. So tulsi is again very commonly available plant. So we can take some 20-30 leaves and we can dip it in the slightly lukewarm water and then take out and crush it. Take the juice, nearly 3 to 5 ml, 1 to 2 spoon. Add little bit honey in that and just take it. It will help a lot to reduce the symptoms. The another very common drug is the ginger juice with honey. So ginger juice again we can take 1 to 2 spoon and add honey in that. We have to take only 2 times or 3 times maximum. Do not take frequently and do not take more of this ginger juice, because again if you are taking more of this ginger juice, it may create side effect also. Or suppose if the ginger juice is not available, you can take the powder also. So powder you can take 2 gram, approx 2 gram, mix with the honey, and that also you can take. And you can make a this herbal tea, that also you can make by adding ginger juice and turmeric powder with a 1 cup of warm water. That also you can make and you can drink it. It will help a lot. And black pepper with honey. So kali mirch. So that is also common available in our kitchen. So that we can take nearly 2 to 3 kali mirch, make it powder, and then take it. When you are giving it to the small children less than 3 years, you take only 1 kali mirch. Do not take more, because it is having very ushna guna. It is very hot in potency, so it may create problem for the children or the person who is of pitta prakriti or having the heat, more of heat kind of nature. So that person will suffer more. So he or she has to be little careful whenever they are taking black pepper. For the person who is kapha in nature, for them it is fine to have 2 to 3 kali mirch or the black pepper. Or black pepper with ghee and sugar candy. So that is also one of the good preparation, and it will help a lot for the allergy to overcome the allergic rhinitis in initial phase. So there are publications also, research publication, pharmacological benefit of tripla, a perspective for allergic rhinitis. So it is proven that the tripla, a very commonly available drugs, is helpful to overcome the allergic rhinitis. The next important thing is when we have to see a general physician or doctor. So long standing symptoms. So already we discussed that person is suffering more than 4 days a week and for more than a month. So it is the time that he has to go and take proper treatment to overcome this problem. And do not goes on trying, even if it is helping to some extent, but do not goes on trying when the symptoms are long standing and when symptoms are getting worse. So you are trying with the home remedies, but it is not helping you and the symptoms are becoming more and more troublesome. There is a breathing difficulty, there is a running nose, there is a watering from the eyes. All these symptoms are continuing. So do not goes on trying with this home remedies. It is better to go and consult a doctor, because in later stage, the same kind of situation may cause development of polyp inside the nasal cavity, or it may cause a severe kind of breathing difficulty. So to avoid such kind of problem, it is better to consult a doctor if the symptoms are goes on worsening. And when the person is having asthma and it is triggered by the some allergens, in such condition also it is better to consult a doctor and avoid using these uh, home remedies or the whatever we discussed about the initial management. And whenever primary management is not useful, so this is the time when you have to consult a doctor. And unable to identify what causing problem. Suppose a person, he never suffered with any of these kind of problem, or he suddenly developed these all symptoms, and we are unable to understand what is a particular thing which has created problem. So suppose he is very much in the normal routine, he is taking the same kind of diet, his routine is also same, but suddenly he has developed these kind of symptoms, all which are there in the allergic rhinitis. So when we are not very sure what are the factors or what is the particular thing which has created this problem, it is better to consult a doctor. And allergic rhinitis associated with other health issues. Person is having only running nose, sneezing, these things, that is fine. You are trying with the home remedies. But suppose the person is having a running nose, sneezing, etc. Along with that, he developed conjunctivitis and he also have some skin eruptions all over the body. So there are so many complexities, so many associated problems to the person. So that is also the time when we have to go and take proper treatment, because only these home remedies may not be enough. And if you are neglecting, that may create a more severe and emergency condition. So it is important, when the allergic rhinitis is associated with so many other health issues, then go and consult to the doctor. Then affecting sleep and normal lifestyle. Suppose the person is unable to sleep and his lifestyle is completely affected. He is not able to perform his routine activity because of the continuous sneezing, continuous running nose, or breathing difficulty. So that is again a time when we have to go and consult a doctor, and do not just go on trying the home remedies and neglect the situation. So we have to be careful. Home remedies are very beneficial, but only in the initial situation when symptoms are not very severe, mild symptoms that you can easily manage with preventive care and with initial management. But if the symptoms are severe, long standing, associated with many other health issues, so that is the time when we have to take proper treatment from a specialized person. So this is in short about the allergic rhinitis. So if any of the participant would like to share something, or if they have any query, they are welcome to ask. Still we have more than 15 minutes. So
नमस्ते सभी को। नमस्ते भैया।
जी नमस्ते दीदी।
I would like to know that in such conditions, can the immunity be improved by using the lemon with it is a saying actually that in the fresh just cooked dal which is very hot right now, that is just taken out from the gas and open it and use a lemon in that will improve the immunity in such cases. Is it true, Bhaiya?
Actually, when you are this dal ka pani, what we say, the fresh, the warm soup of this dal, that is helpful. If you add some of the Indian spices in that, like if you are adding little bit kali mirch, jeera, all those things, so that will help. Only dal will not be much helpful. The only dal will helpful because it is ushna, it is hot. So it will give some relief to the nasal congestion or throat irritation, these kind of things. But if you are preparing a soup with adding some of these ginger, kali mirch, jeera, all those Indian spices are proved for helping in allergic rhinitis. So you can use this. Even you can use little bit hing, lasuna, all those things. So if you are adding these things, it will be more beneficial for the person who is suffering with allergic rhinitis.
Okay. ठीक है भैया, thank you.
Easy.
Thank you भैया.
Welcome. Yeah, someone else can also. You may share other than this topic also, not necessarily this topic only. If you have any query related with any of the previous sessions, so that also you may ask, or you may share your health experiences, whatever the practice you are doing, how you are benefited. So, or previously you were suffering with something, now you have got some relief from that problem. So that all will be helpful for everyone.
Bhaiya, I have one question regarding the hair. Will it be, I mean, shall I ask that question?
Yeah, please.
The hair quality is very dry and rough. So, whether the food quality will improve this problem, or the shampoos we are using that will improve the quality of the hair? How do I handle this issue?
You have only dryness of hair or the hair falling,
Hair
whitening
falling,
of the hairs, all these
both.
things?
Yeah, it is there. All these issues are there.
Okay. Actually, the hair fall is maybe having several problems, several things may cause hair fall, including from your genetic factor, like if your parents, grandparents, they have this kind of problem. So genetic factors are also responsible for this. Along with that, the kind of water you are using for hair wash, whether it is hard water, soft water, the kind of shampoo you are using, and how many times you are using in a week, kind of hair oil you are using, lifestyle, if you have a healthy lifestyle, the food which you are consuming, tension, so some psychological issues that also causes nutritional. If you are taking proper nutrition, not like for the growth of the hair, and for healthy hair we require biotin, vitamin B7. So whether it is there in your food or not, so many problems, so many things are there which are required for our healthy hair growth. So generally what we suggest is not to use the detergent based shampoo.
Okay.
You use maximum once in a week, or whenever suppose we are traveling, we are exposed to the dusty environment and there is a lot of dust came in our this stick to our hair or head. So we ask to clean it with shampoo, no issue. But some of the people, they are using this in routine. So what happens is that makes our scalp very dry, because whatever we say that it is herbal shampoo, soft shampoo, protein shampoo, whatever we say, it creates lot of froth, lot वो जो झाग बनता है, so that is because of the presence of detergent in that. So that is creating a lot of froth and it makes our scalp very dry, hairs very dry. So that is all happening. And again, the kind of hair oil we are using. So we are always suggesting do not go for very costly hair oil. If you have a pure virgin coconut oil, that is very good for your hair. You use till oil, the sesame oil, that is very good for your hair. In all the season, you can use that. And suppose little bit, suppose if there is a winter season, so we add little bit karpura.
Okay.
That you will, it will help and it will give some warmthness also. So, and one important thing is whenever we are applying hair oil, we have to do very good massage to our hairs, to our scalp. Yes, when we are doing massage, what happens is the circulation of our scalp is increased.
Yes.
That increased circulation will help for the proper nutrition of the hairs. So hairs also require nutrition. What happens is when we are, most of the people, they just apply hair oil for some shining or some kind of like proper combing. They do not do proper massage. So you have to do proper massage to your hairs. So these all will help you. Then if you are having lot of stress or these things, you are taking lot of tea, coffee, so that will also decrease your hair health. So that also we have to cut down. So mostly actually the hair health is related with our overall healthy lifestyle. It is not one thing which is responsible for hair.
Yes.
So several factors are there, and one simple procedure which we suggest for healthy hair is doing this nasal installation, Nasya Karma. So Anu Tela, it is commonly available, prepared by several pharmacies, so including your Patanjali, Kottakkal, Vaidyaratnam, Dhutpapeshwar, Nagarjuna, all these pharmacies, they are making this Anu Tela. Anu Tela, putting 3 to 4 drops in each nostril. That helps a lot. It will help from the allergic rhinitis. It is also helpful for hair growth. Including decreasing the, preventing from whitening of the hairs. So it is helpful for that also.
Okay. And regarding, you said some protein.
Yeah, biotin, etc. That is, but we have to see whether in the food it is lacking or not.
So that's why I'm asking which, I mean, which food item contain this particular protein?
See, most of our leafy vegetable, green vegetable, actually it is available in our vegetarian diet itself. It is not something which we have to get from some other sources. Our vegetarian food contains enough amount of biotin B7. So what, like consuming dal, consuming green vegetables, that all will help for your fulfilling your requirements for this biotin. There is no need. If there is a lacking, then there are pills available, biotin, vegetarian, this as a food supplement that you can go for, and it is water soluble vitamin. So no issue with taking this also, but we have to see, because the loss of hair or the reduced hair quality is less because of that nutritional deficiency, is this biotin, etc., but because of several other factors. Like stress, lifestyle, or unhealthy routine, lack of sleep. So many other things are there. Not just one your lack of biotin or some vitamin. There are so many other factors which are associated with the hair fall and the reduced hair quality.
Right. Okay, Bhaiya. Thank you so much for the valuable information.
May not be very specific for your, but this is in general how we can protect our hair health, and how we can improve our hair health.
Right, Bhaiya. Thank you, Bhaiya.
Bhaiya, namaste.
जी भैया नमस्ते.
Even whitening of hair, can you throw some more light on the whitening of hair, as young children are sometimes more light on the whitening?
Yeah, generally in Ayurveda we say it is because of the increased pitta. Pitta dosha, when it is increased, it is causing all the whitening of the hairs. So again, if the person is more than 14 years, so we can go for a simple purification process to reduce this increased pitta dosha in the body. And another important thing is whatever this the packaged food, all the chips, kurkure, etc., all these bakery products, cutting down all these bakery products, pickles, sauce, tomato sauce, and all. So these things cutting down, that will help a lot. So again here, maintaining healthy routine and healthy food habits will help to reduce this whitening of the hairs. And next important thing is I will suggest to go for the routine Nasya Karma using 3 to 4 drops of Adu Tela
So this
each
Pitta
nostril.
dosh purification.
In each nostril.
Which oil?
Anu, ANU, Anu Tela.
Adu.
Anu, ANU,
ANU.
Anu Tela. It is available.
Right.
It's very commonly available. Any Ayurveda shop, you will get this. So 3 to 4 drops after the brush. If you put in the nostril, initially for 3-4 days, it is slightly irritating. Whenever you are putting to your children, they may not feel very good about it. But once it will, you will continue it for next 3-4 days, he will be very comfortable. That will help a lot for strengthening of the hairs, and including it will reduce the whitening of the hairs. So that all it will help. It will cleanse the excess of whatever this congestion, etc., that is there. So that all it will do. It is extremely beneficial. And generally, we suggest this to all the people who have this hair problem to practice this Anutela, installation of Anutela in nostrils. So after the brush, he has to take it, and immediately after putting this, do not take any warm or cold thing. Like immediately after putting the Nasya, do not go and take coffee, do not go and take some juice or some cold water. So for at least half an hour, avoid consuming any hot substances or cold substances.
So it is to be done in the night when you do the brushing of the teeth.
No, morning time. Morning when you do the brushing.
Morning time. Okay. Morning time.
You can do twice also, but at least start once in a day after the brush.
Right.
So it is part of our daily regimen, and it is very beneficial for our hair health.
Right.
And again, you use til oil for this, for your hair, and do massage for 15 to 20 minutes. Or you can go some of the traditional oil instead of going for very costly oil. See, whatever the costly oil which are there for 1,000-2,000 rupees, the basic ingredients are til oil and some of the herbs, which is available with a different name in our like the traditionally which we are using, like the Bringamlak Tailam. Bringamlak Tailam is very beneficial for our health, for hair health. And the same kind of oil with some of the modification, it is available in very like many of these pharmacies. They change the name, they put their own name, and they brand it and they sell it in a very high price. So instead of going with these kind of things, go with the traditional, what we say, the whatever our ancient system of medicine is suggesting. So that kind of traditional preparation will be more beneficial. So bring Amlak Tela, Neeli bring Adi Telam, or if this is not available, simple tail oil is very good.
Right.
Or if you have availability of coconut oil, pure coconut oil, so that is also. Do not go for parachute and all.
Okay.
Go for pure coconut oil if it is available, or the virgin coconut oil, so that you can go. Do not go for this all branded and this parachute or Malabar or so many other.
Right way.
So yeah,
Thank you so much.
welcome. Yeah.
Ji, nice bhaiya. Really a very enriching session, and it's almost time. And it's always, for me, it's very enriching to listen to you and this interaction also. So let's respect the circadian rhythm and call it a day. And we really like to have more and more such sessions. So thank you all the co-explorer, and thank you, Akhilesh bhaiya. We'll meet again next Friday for more such sessions. So thank you everybody. Namaste.
Namaste to all.